Today, we are going to learn about RDE message type in HL7. What is the purpose of it? So, if you want to answer about RDE message type in interview, you should know what is the main use of it. So, as we know, we are going to create a problem first and answer a solution for it. It's a better way to remember. So, what is the use of RDE message? So, there's an interesting scenario which I'm going to make it as funny as possible for the explanation purpose. So, if you're going to a restaurant and trying to order a pizza, what you will mention? You don't say just a pizza, a chicken pizza or a veg pizza. No, right? There are a lot of specifications like large crust, large size, thin crust, extra cheese, half chicken, half mushroom, whether delivered to home or it's pickup. There are a lot of things which you mention. Similarly, if a medicine is being ordered by a physician or a pharmacist, there are a lot of things they need to discuss. It's not just like they say, okay, take Advinol or Tylenol. Tylenol. There are a lot of medicines are in the market. They need to mention a lot of things like the drug name. Okay, that's a very common thing, right? And they need to mention dosage. For example, if for a patient one, the dosage might be like 20 mg, there might be a different patient. The dosage should be around 80 mg or more. So it should be very specific. They cannot say if the drug name is some particular drug. I'm not. They cannot say the same drug should be, for example, if the drug name is XX, they cannot say the same should be mentioned for each and every patient. They should specifically mention. Imagine just for a pizza, you are mentioning a lot of things, but for drugs, you should be more accurate and more specific. It's not just about dosage, the frequency, how many times the patient should take. Each and every patient has a unique frequency over here, whether it's like 2 times in a day or anything. And the duration, for how many days it should take. For example, if at frequency, it will like two times per day. Don't get confused with frequency and duration. Duration is like used for 2 weeks. So each patient has a unique scenario. For example, if there are like 100 patients using the same drug, the physician might suggest the usage of a drug in different ways for 100 patients in different scenarios, depending upon their blood work, depending upon their uh, issue. He might suggest in a different ways, right? So the thing is like, how can this be done? With the normal ADT or ORU message, this cannot be done. With the normal ADT ORU message, you know what are the segments and fields are available. It cannot be done. For that purpose, HL7 has created a separate message type is known as RDE message type, which is nothing but a pharmacy message type. So all the pharmacy details and everything will be done in RDE. So what is the specialty of RDE? Means it has all the details of that particular drug. If a physician is placing an order, all the details are inculcated in it. So I'll paste a sample pharmacy message type over here. You can see it has a basic MSH and PID, but it doesn't have ORU, ORM similar like ADT because it is a unique RDE message type for the pharmacy, right? So it has different things like the RXC and RXR segment with the drug names, the MGETs, and how many times. There are a lot of specific details. So I just want to introduce to new tool in this video. I generally use HL7 inspector for online editing. It is very easy to use. So I just copy that particular message type over here in the tree view. Okay. Yeah. This is a message type. In the tree view, you can compare what are all the things over here. Okay. This is bugging me up. That's not a problem. Okay, this is not working. I introduced, but yeah, it's not working. That's okay. It worked previously. I want to try it once again. Okay, this works. This works. Cool. Yeah, you can see in the other messages like this MDM, we have different segments, but for the RD, we have different segments. So I'm just going to copy it over here. It's not getting copied. Once again, I'll copy it. Don't get confused. Perfect. Yeah. For the RD, we have different segments and different details. Yeah, so yeah, now it's working. If you go to review, you can see the RxC. If you click on this particular thing, it says this is a given code for the particular drug name. For example, there might be multiple drugs. There's a drug name with amoxicillin. There might be another drug name with the same name. So it's always important to give a specific code for each and every drug. And it says 500 mg. Over here, you can see given units and given dosage 6 mg and providers administrator instructions. There is some code, substitution status. So lot of things. I just mentioned only few things for the dosage and everything, but in reality there are a lot of fields and a lot of things and how it should be taken, right? That's important, right? Whether it should be injected or whether it should be oral, or you can see it's oral. So this segment is very important. RDE message type as RxE segment and multiple other segment which deals with the pharmacy treatment. Okay, so that's very important for the pharmacy to use and communicate between different department. How they are going to communicate is nothing but with the RxE segment. So there are like few use cases which I am going to post over here. Like if doctors orders antibiotics, pharmacy department receives exact encoded prescription, which is mentioned over here or like which you can see over here with the exact prescriptions and codes. Okay, so chemotherapy order sent with the exact dosage and calculation. So there is no confusion or no issue because a nurse cannot remember what type of medication should be given, like what is the dosage for different patients. There'll be thousands of patients. Nurse might be having like multiple shifts in a week. They cannot remember patient. So with this particular message type in that particular EMR portal or the task assigned to her, they can easily see what's the dosage for individual patient. For this patient Don Joe, this is the dosage. So in real time, this is a very simple RxC, but there may be multiple RxC segments. If the patient has cardiological issues and he is using blood thinners and he has problem with eye cataract issues, a lot of issues. So a lot of RX segment will be coming with different medications. So you need to remember that. Like hospital bedside system sends encoded medications to robotic dispenser. Again, this is one vast topic. There are like multiple projects going on. So when someone places an order, automatically there'll be a robotic dispenser that will dispense the particular medicines to the patient. I don't want to confuse you with explaining this. I can explain this for several hours or several days. So let's jump to the basic RD concept. So I'm going to place a few more examples over here, like what are the real-time problems and solutions, like without HL7, pharmacies may misread medication request. As I said, a nurse or a physician, like a pharmacist, can misread the dosage because every patient has a specific dosage. For example, even if you are using D vitamin medicines, there's a dosage. Omega 3, there's a dosage. Vitamin C, there's a dosage. So with this particular RD, all problems will be solved. So that's the purpose RD has been created. Duplicate or machine patient record. So each RD message links medications order with patient identifiers. Mean in the RDC message, you can see the patient identification. Means this particular medicines are belong to this particular patient name, the patient MRN number, and the hospital details and all streets. So it is linked. There is no concept of the medicine of one patient being given to other patient. Like orders flow instantly from EHR, which the physician uses. So in normal terms, I can say a doctor uses this portal. EHR is again nothing but, okay, I typed it wrong. Yeah, EHR is nothing but, for the rookies, I'm explaining a web application where doctors orders and it goes to the pharmacy. Pharmacy, there'll be pharmacists. Okay, I don't want to type everything, and they will be verifying the orders, and that goes to dispensing systems, the machines which will deliver. So you can say it as a delivery system. So I worked with multiple delivery systems: ATP, box picker, Pixus, Barium. There are a lot of delivery system. So for example, a patient Patel a doctor Patel prescribes amoxicillin. It will go to EHR. EHR can be Epic, Cerner, Meditech, whatever it can be, and it goes to pharmacy. There'll be another application in the pharmacy again that goes to nurse administrator, so they can give it to Jodon without delay. So it's a very simple process. Doctor won't go to nurse and say that you need to give it. Everything happens to different application, and RD will take care of it. That's a very simple end-to-end process. So in my real time, I'm just going to give an example which I actually faced. One patient, heart patient. This is a real-time example which I faced on one midnight. No medicines were given on one particular day. So I've, we got a call and we got a ticket, and I was unable to understand what's actually going wrong. There was some issue at the server end, and one HL7 message trigger has not went. But when we restarted the server, there'll be major instance happening in every hospital servers and backend. At that time, around three duplicate messages went to the same patient. Means this amoxicillin 500 mg has been went three times, and for the same patient another medication also went three or four times. So for example, if on one day the medication has been skipped, that's okay. That will not be causing major issues depending on patient severity. Maybe it can be a major issue, but it's not like life threatening. But on the next day he is going to get multiple medications. Not only this, due to server issue, he is going to get multiple medications. So I had to stop it because those were duplicate medications. So this is very important. I'm just giving a real-time scenario, like you can explain in your interview questions and answers that this happened and I stopped it and I protected the patient. So it's very, very dangerous. So RD is not a message type to ignore. There are a lot of things which are going to RD. Whole treatment runs with the RD. So I want to highlight not only ADT or URM, but even RD message type. It one of the gem. I hope you got a lot of details for the RD segment, and you can answer easily what's actually going in the RD. So if they ask where are the medicines details in the RD, you can directly jump to the segment and explain, hey, these are the details. And if you ask me, do you need to remember all the fields, like which field has which dosage and everything? No. In real time, they don't ask what is RxC 6.1 or 6.9. Mostly they will show you the examples, or they will ask you the scenarios which you faced in real time, like I explained about the scenario, right? I think that's it. We covered high level topics about RD. Hope you understand the pizza comparison information, why there is specific message type for RD. Have a great day. We'll continue with more topics. Thank you. Bye.